Hi, my name is Michelle Chaffardet. I'm a licensed marriage and family therapist. I am a couples therapist trained in the Gottman Method. My goal for the first 5 minutes of the session is to make them feel comfortable, to let them know that they are okay, they're in good hands, right? I reassure them that they can do this. I let them know that it's totally normal to feel nervous or unsure. I make sure to ask open-ended questions and to make sure that I'm giving each partner space to speak. When there's two people, there might be two people being upset, two people being hurt, and they don't even know sometimes if they want to be there and stay together. So I'm trying to connect with both of them without taking any sides. And it takes a lot of care, it takes a lot of patience, and a lot of awareness to make both people feel heard and safe right from the start. Things that I do in a virtual session to make the couple feel more comfortable are things like keeping my backgrounds calm and clean, nothing too busy, nothing too distracting. I use soft lighting, I use eye level with the camera. I keep my boys warm and steady. If they're nervous, I slow down. If they're laughing or even being playful or cracking a joke, I also allow space for that. So it's the little things like a gentle smile or a nod that can go a long way in any virtual session. Sometimes I know from the get go that one doesn't want to be there. I can tell who's excited about seeing me and who's not. What I do is if I notice that one person is actually the one who doesn't want to be there, I call them out. I call them out, but not them as a person. I call it out. Like, what is happening, right? The other person's chatty. They're telling me everything. I might even interrupt. That's wonderful. That's great. I'm wondering, let's pretend, Kevin. I'm wondering, Kevin, how do you feel about this? What's going on right now? Because I see a little bit of discomfort. Am I wrong? Am I getting this right? And 99% of the time, they're like, yes, I'm not feeling comfortable, or this is what I'm thinking. So I just address it. We discuss it together, and then I just bring them back. And that helps a lot. In the first session, I provide a lot of psychoeducational. So even if we don't get to the nitty gritty, and I am very specific that this is not something we're going to solve in one session, the intake session, we're getting to know each other. I want to know your mental health, your health issues, all of that, right? So that's a little boring for them because usually they come in and they're like, we are in a crisis. We need to fix this. And I'm like, nope, hold your horses. We're going to take it slow. But I make sure that they leave with a little Gottman tool, a little like, this is what Gottman's about. And so they leave excited for what's to come. I think every couple that I see comes back because of that, because I'm very conscious of giving them a tool, even if it's not the tool that's going to take them to super success. But if they get out of the first session feeling like, wow, I actually learned something, let me start implementing it, they can hold off to the next session. I must say, not every therapist is for every client, right? So we all have different personalities. And so we're all looking for something different in a therapist style. And I am very solution focused. Gottman has a lot of skills that I get to teach. So it's very directive. It's not just psychotherapy. It's not just talk therapy. I'm actually telling you what to do in a sense. I'm teaching you a new skill and then I want you to go practice it. So a lot of my couples like that. They like the Gottman approach because of that. Because they're like, we went to a couples therapist and we just kept talking about the same thing. What else can we do? And then I come in and say, well, you can do all this.